Good morning, ladies and gentlemen. Thank you for coming. An honor to meet you here. Let me introduce myself. My name is Krispinus and I am a student from Ganesha University of Education. In this occasion, I would like to deliver my speech about the dangers of nicotine in the body.
Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades. But how exactly do cigarettes harm us? Let's look at what happens as their ingredients make their way through our bodies and how we benefit physically when we finally give up smoking. With each inhalation, smoke brings its more than 5,000 chemical substances into contact with the body's tissues. From the start, tar, a black resinous material, begins to coat the teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages nerve endings in the nose, causing loss of smell. Inside the airways and lungs, smoke increases the likelihood of infections, as well as chronic diseases like bronchitis and emphysema. It does this by damaging the cilia, tiny hair-like structures whose job it is to keep the airways clean. It then fills the alveoli, tiny air sacs that enable the exchange of oxygen and carbon dioxide between the lungs and blood. A toxic gas called carbon monoxide crosses that membrane into the blood, binding to hemoglobin and displacing the oxygen it would usually have transported around the body. That's one of the reasons smoking can lead to oxygen deprivation and shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain, triggering the release of dopamine and other neurotransmitters, including endorphins, that create the pleasurable sensations which make smoking highly addictive. Nicotine and other chemicals from the cigarette simultaneously cause constriction of blood vessels and damage their delicate endothelial lining, restricting blood flow. These vascular effects lead to thickening of blood vessel walls and enhance blood platelet stickiness, increasing the likelihood that clots will form and trigger heart attacks and strokes. Many of the chemicals inside cigarettes can trigger dangerous mutations in the body's DNA that make cancers form. Additionally, ingredients like arsenic and nickel may disrupt the process of DNA repair, thus compromising the body's ability to fight many cancers. In fact, about 1 of every 3 cancer deaths in the United States is caused by smoking. And it's not just lung cancer. Smoking can cause cancer in multiple tissues and organs, as well as damaged eyesight and weakened bones. It makes it harder for women to get pregnant, and in men, it can cause erectile dysfunction. But for those who quit smoking, there's a huge positive upside with almost immediate and long-lasting physical benefits. Just 20 minutes after a smoker's final cigarette, their heart rate and blood pressure begin to return to normal. After 12 hours, carbon monoxide levels stabilize, increasing the blood's oxygen carrying capacity. A day after ceasing, heart attack risk begins to decrease as blood pressure and heart rates normalize. After 2 days, the nerve endings responsible for smell and taste start to recover. Lungs become healthier after about 1 month, with less coughing and shortness of breath. The delicate, hair-like cilia in the airways and lungs start recovering within weeks and are restored after 9 months, improving resistance to infection. By the 1-year anniversary of quitting, heart disease risk plummets to half as blood vessel function improves. 5 years in, the chance of a clot forming dramatically declines and the risk of stroke continues to reduce. After 10 years, the chances of developing fatal lung cancer go down by 50%, probably because the body's ability to repair DNA is once again restored. 15 years in, the likelihood of developing coronary heart disease is essentially the same as that of a non-smoker. There's no point pretending this is all easy to achieve. Quitting can lead to anxiety and depression resulting from nicotine withdrawal. But fortunately, such effects are usually temporary, and quitting is getting easier, thanks to a growing arsenal of tools. Nicotine replacement therapy through gum, skin patches, lozenges and sprays may help wean smokers off cigarettes. They work by stimulating nicotine receptors in the brain and thus preventing withdrawal symptoms without the addition of other harmful chemicals. Counseling and support groups, cognitive behavioral therapy, and moderate intensity exercise also help smokers stay cigarette-free.
Ladies and gentlemen, nicotine is a chemical that contains nitrogen, which is made by several types of plants, including the tobacco plant. It is also produced synthetically. Nicotiana tabacum, the type of nicotine found in tobacco plants, comes from the nightshade family. Red peppers, eggplant, tomatoes, and potatoes are examples of nightshade family. While not cancer-causing, or excessively harmful on its own, nicotine is heavily addictive and exposes people to extremely harmful effects of tobacco dependency. So, everybody, what are the effects of nicotine? Nicotine has a range of effects in the body. Nicotine is both a sedative and a stimulant. When a body is exposed to nicotine, the individual experiences a kick. This is partly caused by nicotine stimulating the adrenal glands, which results in the release of adrenaline. This surge of adrenaline stimulates the body. There is an immediate release of glucose as well as an increase in heart rate, breathing activity, and blood pressure. Nicotine also makes the pancreas produce less insulin, causing a slight increase in the blood sugar or glucose. Indirectly, nicotine causes the release of dopamine in the pleasure and motivation areas of the brain. A similar effect occurs when people take heroin or cocaine. The drug user experiences a pleasurable sensation. As users become more tolerant to nicotine, they require higher doses to enjoy the same effect. Dopamine is a brain chemical that affects emotions, movements, and sensations of pleasure and pain. If your dopamine levels rise, the feeling of contentment is higher. Depending on the dose of nicotine taken and the individual's nervous system arousal, nicotine can also act as a sedative. Ladies and gentlemen, there are some aspects of nicotine effect. First, from pharmacologic effect. When humans, mammals, and most other types of animals are exposed to nicotine, it increases their heart rate, heart muscles oxygen consumption rate, and heart stroke volume. These are known as pharmacologic effects. And the second is from psychodynamic effects. Consuming nicotine is also linked to raised alertness, euphoria, and sensations of being relaxed. And the third from concentration and memory effects. Studies have shown that nicotine appears to improve memory and concentration. It is thought that this is due to an increase in acetylcholine and norepinephrine. Norepinephrine also increase the sensation of wakefulness or arousal. Nicotine can also reduce anxiety. Nicotine results in increased levels of beta endorphin, which reduces anxiety. Nicotine is highly addictive. People who regularly consume nicotine and then suddenly stop experiences withdrawal symptoms, which may include cravings, a sense of emptiness, anxiety, depression, mood lines, irritability, difficulty, focusing, or paying attention. Ladies and gentlemen, besides that, there are several side effects of nicotine. Nicotine causes a wide range of side effects in most organs and systems. The circulation of blood can be affected in the following ways. An increased clotting tendency leading to a risk of harmful blood clots. Atherosclerosis, in which plaque forms on the artery wall, enlargement of the aorta. Side effects in the brain include dizziness and lightheadedness, irregular and disturbed sleep, bad dreams and nightmares, possible blood restriction. In the gastrointestinal system, nicotine can have the following effects: nausea and vomiting, dry mouth or xerostomia, indigestion, peptic ulcers, diarrhea, and heartburn. Obesity, high blood pressure, type 2 diabetes, respiratory difficulties, infertility, problems with brain development, and behavioral issues. Ladies and gentlemen, other effects of nicotine include spasm in the lungs, pneumonia, tremors and pain in the muscles, increased levels of insulin, and insulin resistance, contributing to the risk of diabetes and joint pain. So, ladies and gentlemen, we know that nicotine is really dangerous to our body. Chewing or snorting tobacco products usually releases more nicotine into the body than smoking. Nicotine is at least as difficult to give up as heroin. The side effects of nicotine can affect the heart, hormones, and gastrointestinal system. Some studies suggest that nicotine may improve memory and concentration. There are more than 1 billion tobacco smokers worldwide. Okay, ladies and gentlemen, that's all for today. And the last I want to say thank you so much for your attention.